It's Atch back with another health highlight from Michigan Primary Care Partners and Y102. Now, this week's topic is a little bit controversial to some people, and for other people, it's a no-brainer. We're talking flu shots. Now, before you sit here and say, I'm not tuning into this, I've heard enough about these vaccinations and all this stuff. Let's go ahead and unpack this a little bit, because this is for the people who are elderly. This is for the people who are immunocompromised. These are for the people who have small children who are going to school right now face to face, and they're coming up in the school system, and, they bring those sicknesses home. And then who gets them? Us. And then we bring them to grandma and grandpa, right? Now, for a lot of us, it may not be something that affects us too bad. Flu can be deadly. It also can just be a couple of days of just misery. But here's what the real thing is: risk versus reward. Okay, what are the risks of getting a vaccination? Worst case scenario, you get a little sick. Okay, and that usually is not because of the vaccine itself. Okay, that has usually nothing to do with it. The reward, you're good to go. You don't get flu this year. And that could be a very good thing, especially because doctors are saying that this flu pandemic this year is going to be a little bit later. What do we need to look at as far as how to get vaccinated, the risks this year, the rewards this year, and who should be the first in line to go and get a flu vaccination this year? Let's find out with this week's Health Highlights from Michigan Primary Care Partners and Y102.
We do recommend a flu shot for everybody above the age of 65 every single year. We do recommend flu shot if you're above the age 50 and are immunocompromised with diseases like diabetes. But flu is an illness that affects the young, the old, the healthy, the unhealthy. It doesn't really discriminate between patients, and it is completely preventable with the help of the vaccine. If you choose to forego, you can have the flu, and then you can have a superimposed bacterial infection, pneumonia, UTI, different. So when you have the flu, you're immunocompromised. Your body does try to fight it, but sometimes it's not able to, and other infections kind of tag themselves onto the flu infection, and that can lead to hospitalization and even death. Especially if you are elderly, you're debilitated, it is important to prevent disease. It's so easy to prevent disease, so difficult to treat it when it is complicated by other comorbidities. It's a simple vaccine. It prevents that from happening. 4 or 5 days of sickness is just not worth it.